morning, and thank you very much for joining us. I am Yori Folari. We continue the lockdown and also reactions to it, and indeed goings on. I'm alongside my colleague Cyril Baku, senior researcher at TVC News. Thanks as always, and good morning to you, Cyril.
A very good morning to you again.
Indeed. We continue with the pandemic and reacting to it and doing our best to keep safe. An encouraging tweet coming from the governor of Lagos State this morning that he had, as a responsible leader, tested himself, and he was happy to report that he and his household are negative, as well as his aides. Okay, an important tidbit there. We will be speaking with the Minister of Information, who has consented to come on Skype. So whatever the challenges are, the lighting might not be all that it needs to be, as you can see there. But good morning, Alhaji Lai Mohammed.
Good morning.
Oh, okay. Thank you very much for joining us. There might be a lapse, but we'll make it work one way or the other. Alhaji, these times are different times for Nigerians. And because of the directive from government, it's advice, it's directive at the same time, you must have heard the reactions that people are saying they need help. Now, I know you can tell us a lot that the government is doing by way of help, but what could you say to the expectation of people that maybe some money in our pocket, aka bank account? What is the challenge there, sir?
Well, thank you, Mr. Folari. I think the first thing Nigerians must appreciate is that what we are dealing with is a pandemic issue, and that the responsibility of every nation, first and foremost, is to preserve the lives of its citizens. Now, when we ask people to stay at home, we ask them to stay at home because we realize that unless there's a total lockdown, our health care facilities will be overwhelmed, mortality rate will soar, and that in the circumstances, especially given the fact that this particular disease is imported, not indigenous to Nigeria, and that there is absolutely no known cure for this disease at this time. All that we can embark upon is what is called non-pharmaceutical intervention. And this means that people must stay at home, they must keep social distancing, they must wash their hands frequently, they must not congregate. And this is why we decided that Lagos and Abuja and Ogun State will have to be locked down. Yes, it is quite natural for every government to try as much as possible to soften the impact of this kind of lockdown. But every country is going to adopt strategies that will work for them. The strategies we are adopting are those that are practicable, feasible, and sustainable. And I think one of the first things Mr. President in his broadcast said was that satellite towns in Lagos and Abuja will be provided with relief materials. In addition, the president directed that those who have been enjoying what we call, conditional cash transfer through our social intervention program, social investment program, must continue to enjoy them, and that in addition, instead of the being paid monthly, they'll be paid 2 months, to cushion the effect of this lockdown. And it must be said here that those who are enjoying this are not limited to one part of the country alone. with the help of the World Bank, data has been built over the last 3 years, and we know exactly how those people are reached. But because of this lockdown, we have had to redefine those who will come under this bracket. In addition, the President directed that the school feeding program should continue despite the fact that these children are at home. And this is because in the last 3 years, the beneficiaries of our school feeding program, which is more than 10 million pupils all over Nigeria, have been used to this, and their parents have been used to not, feeding them, during this time. So the federal government said this program must go on.
Alaji, could I interrupt you, Alaji? Could I come in a bit, Alaji? Alaji Lai Mohammed.
Limited to just one part of the country. We have IDP camps in various parts of the country.
Could I come in, Alaji Lai?
Has now been doubled, so that since they cannot go out during this period. In addition, the federal government directed also that there will be a moratorium on the payment of farmer money, trader money, and all these interventions of the federal government.
Alaji Lai, I'm trying to get a word in. Can you hear us? Aha. Alaji Lai, fine.
Yeah.
Yes, sir. I appreciate what you're telling us, and I must say that we have heard it, some of it. But the question I started with was the expectation that the federal government might be able to do something by way of direct, I hear what you've said, directly, as it were, putting money in their hands, as indeed we are seeing in some areas. Are they unreasonable to be expecting that will happen?
Well, I think regrettably, when we started fighting this pandemic, we were also fighting fake news. And fake news has remained a serious distraction to our fight of the pandemic, because these agitations were heightened when some newspapers published that the federal government was going to pay 8,500 naira to the account of everybody with a BVN. You see, there was nothing like that by the federal government. Like I said at the beginning, every government in the world will adopt strategies that are sustainable, workable, and practicable. And these are the ones that we are doing. Because in addition to the fact that the federal government said there's a moratorium on payment of trader money, farmer money, and market money. In addition, central bank has also directed that a 50 billion fund be put aside to target households, small and medium-scale enterprises. And at the same time, interest rate has been cut from 9% to 5% in respect of intervention funds. We believe that these steps which have been taken to cushion the effect. And don't forget that if we do what we ought to do, this lockdown will be over in a very short time.
Yeah, but people are saying that the challenge that they have is that not everybody has the money to stock up, and so they have seen pictures, television pictures of monies might be going, well, that was actually physical cash that we saw on television, that was being earmarked for some areas. And here I want to be a bit careful, but your colleague minister in the Ministry of Humanitarian Affairs, is reported to have said that some parts of the country, there are no poor people there, and so they are concentrating their efforts elsewhere. So it's all a bit confusing. Number one, we're seeing money, at least on television pictures, that federal authorities seem to be preparing for disbursement to some, and at the same time, one of your colleague ministers is saying that certain parts of the country, there are not too many poor people there, and so they're not concentrating on them.
I don't believe that the Minister of Humanitarian Affairs said anything as such. What she did, what we have been doing, is that we have been implementing the directive of Mr. President in respect of interventions, in respect of softening the impact of the lockdown. And like I explained from the beginning, our social investment program in the last 3.5 years had been running, and it has been targeted at the most vulnerable Nigerians. And these people are not limited to one part of Nigeria. It has been targeted at IDPs and every part of Nigeria. It has been targeted at the school feeding program, which actually covers every part of Nigeria. So any misinformation or misinterpretation is just a sad development. The federal government intervention palliatives are not directed at one part of the country.
Okay. Alhaji, we're going to take a break here, but stay with us, please, because we'll come back to you. We'll revert to studio and talk about these matters a bit. So we'll reconnect with Alhaji Lai Mohammed and see if we can fix some of those technical things. Okay. The minister is actually trying to explain, but as I was saying, some people, some parts of our country seem to be within the radar of, getting help. And it would appear, but we don't know, we'll probably be able to clarify that later on. It would appear that not others.
No, well, I think what I'm going to start saying is that what is sauce for the goose is sauce for the gander, should be sauce for the gander. And so if you do it to the left-hand side, you should also apply it to the right-hand side. The fact is that the lockdown primarily is to be implemented in Abuja, Lagos, and Ogun. These are the mapped states, as it were. Lagos is the epicenter. And so I think the Commissioner for Agriculture in Lagos that said that these people in the informal sector, these people in the satellite towns, who are mostly in the informal sector of the informal sector of the economy, make up 60% of the target group. Which means if you cut them away from their daily wages, you're going to bring a lot of hardship on them. The president himself acknowledged in his Sunday speech. He said that these measures are not going to be easy on anybody, but they are required for us to deal with the pandemic. And so if you crave our understanding to adopt or to adapt with what needs to be done, it is only also wise and logical that whatever should accrue to help us assuage the pain or assuage the hardship should also not pass us by. The fact is that if you look at the share, even on the face of it, if you look at our cities, poverty and wealth exist side by side. That is a given fact. And so these bus navigators, beggars, furniture workers, auto mechanics, and so on, when they are locked down on day 1, on day 2, on day 3, I can tell you for a fact that in many neighborhoods, these women that sell ewagon and bread and akara and fried yam, they complain that, look, a lot of our customers have taken so much from us without paying.
On credit.
That federal government is distributing cash. That when they get those monies, they will come over and pay us. Already, in the few centers that Lagos government has been, going to distribute food, I think Alimosh and some other places, when you see the throng, you wonder. You know why? Because when they are told to lock down, they are expecting that it is only normal and natural that this sort of thing will come to them. And so what we may accept eventually that reaching every single person may be impossible or may be difficult. Mm-hmm. But we must make sure that I think as Awolowo used to put it, to make sure that the greater good reaches the greater number. And so when we map and say there are about 60% of them living with us, what's our best case scenario for reaching out to them? You need a model, you need structures. In fact, now as I speak to you, it is taking the sheer ingenuity of some public spirited groups and individuals who are now owning the fight in their own little ways.
And are making contributions
Going out
to the effort.
To distribute food, hand sanitizers, face masks. If you ask me, I would say that I think between when we began to plan and foresee that we're going to have an eventual lockdown and now, perhaps we could have done more with better planning. But whatever the case is, the question is from where we are, what can we begin to do better?
Indeed. And as soon as we can get the minister back, as they're trying to work out stuff, in fact, going back to the very, very beginning of the planning, even though maybe, this is not time for a blame game, but people are saying that, look, if only we had shut down our borders earlier, much earlier, we'll let the minister react to that when he comes back. Perhaps we wouldn't be in the situation that we are now. But being as all of that is in the past, it's more about now. And we have heard people, and quite frankly, everybody can see that this lockdown is not exactly working the way it was intended.
It is not.
It is not. And yesterday we were saying that we were talking about Lagos State, the efforts of Lagos State yesterday. And as a matter of fact, when we bring on the phones, we'd like our viewers, our irreplaceable viewers all over the country, to phone in and tell us what this is meaning to them, what palliatives, which I think is a word that was first of all strange, but everybody has come to understand it now, what assistance has been received from whatever quarter in your part of the country, because that seems to be it. Lagos State was talking, they have their emergency markets, and I believe also I saw something else about some people bringing on the idea of taking produce, vegetables and all of that to neighborhoods. We don't know how well that is working, but it's all going back to this whole planning thing, and people are saying in Lagos, where we are broadcasting from here, but we've also seen film reports from other parts of the country. What do you want me to do? I understand your stay at home. I'm seeing it on TV. I'm seeing it from Britain. I'm seeing it from Italy. I'm seeing it all over the place. Stay at home. I'm seeing all of that. But you want me to die? You want me to die? So it's a problem. Government is really, it's really between a rock and a hard place, because they had to. In fact, it was the response of government and to those calls that some governments have now opened up a bit, and have said that people can go to the market for certain hours. I think in Kaduna it said, and that will be the situation every 48 hours. Now, of course, clinically speaking, this is really rubbishing the whole effort. The whole effort to stay at home so as not to transmit. But I suppose government is realizing it's a problem.
And I think that, I made this point on a program some days ago. I said, look, some people may not be happy to hear the word prayer, but we need to pray. The fact is that, you see, the journalist in me would have loved to ask the minister a simple question on Koyori, to the effect that if I'm allowed as a market man or a market man to go to the market, I sell tomatoes and beans and rice, and market begins 10 a.m. through 2 p.m. It means that as early as, the way I said is that as early as 7 or 8 a.m., I should be on the way. Does that also mean that commercial transporters are now at liberty to converge from one point to the other? Okay. It's important.
These are the challenges that we're talking about. Let's go back to Alhaji Lai Mohammed now, the Minister of Information. Okay, Alhaji Lai, we're back. Okay, Alhaji Lai, we're back together again. We were talking about palliatives. We were talking about these palliative situations. As a matter of fact, because of the way the cameras are, I'm looking one direction, he's looking in another direction. So, okay, let me sort of work it out. Let me talk to Alhaji Lai, which means I'm going to be looking in this direction. Okay. Just so it makes a bit more sense. Alhaji Lai, you were talking about palliatives and what has been done. But before we had to go away to do a little bit of correction, there's no difference as far as I can see, but, we were talking about, might we not get money? Could people expect to get money? And you were saying that you used that opportunity to talk a bit about fake news, that there were some people muddying the water by putting out fake news. Alhaji, what would be your response to the fact that people are saying, we're damned if we come out, we're damned if we don't? What can we do?
I think you have to come louder. I can hear you.
Okay, I'm going to try. We're still on this whole matter of what can the government do for us? That is the question that seems to be coming from the ordinary man. You've explained a lot about what government has been doing, and other government officials have been explaining this. But the ordinary people, to the extent that it's not seeing money in any way, shape, or form, this translates for him to, being assisted. Now, what do we do to that situation?
Mr. Polari, I'm afraid the connection is very poor. I can't hear you at all, sir.
Okay, would you like to continue then along the lines you...
Can you please write the question on the screen that I answer
Well, it wasn't as bad as this before we went away. Oh dear. Okay, Alhaji Lai Mohammed, can you hear me now?
No, sir. I can hear you, but I can't get your question.
People want money in their account from federal government. Did you hear that, sir?
Are you saying that people are suggesting federal government putting money into their account?
Yes.
Yes.
Yes. Okay, you couldn't hear that. Okay, let's go to some other area. That might be too direct, and there are challenges there. How about, is the federal government considering tax rebates? Taxation? Rebate?
Well, you see, I think after the explanation I've given, the federal government has already asked that there be moratorium on certain loans. The federal government already has also asked the central bank to reduce interest rate from 9% to 5%. The central bank put that on its own on any loan from Bank of Industry, Bank of Agriculture, or Bank of the Nigerian Import Bank. So, and in addition, moratorium have been placed on payment of trader money, farmer money, or market money. And as we go on, we look at what further alleviation we can give Nigerians. And I have to explain to you also, the central bank has also put aside a 50 billion fund to help households and help small and medium scale industries that will be affected by the lockdown. Okay. So all in all, we've embarked on measures that we believe are sustainable and are practical.
Can the people expect a tax rebate?
And don't forget,
taxation.
On the 18th of March this year, as a result of pandemic, the federal government also reduced the price of fuel from 145 naira per liter to 125 naira per liter, and about 4 days ago, further reduced it to 123.50 kobo a liter. All these have been done to give succor to Nigerians, because a lot of our transportation depends on petrol, and the cost of transportation is also a major factor in the cost of food items. So we believe that with all these measures put in place, the federal government is conscious of reaching the largest number of people in their palliative measures.
Let me ask you, Alhaji, are there regrets over not closing down our borders, airports earlier than we actually did?
Yes, you see, we have had that complaint, but I think, like Mr. President said, in this kind of situation, there's nothing like overreacting or underreacting. It's about taking the right steps. I can say very proudly that way before the first index case was recorded in Nigeria, the federal government had prepared for this pandemic. And I'm going to give specific examples. On the 31st of January, the first multi-sectoral interministerial committee on tackling the pandemic was activated. A few days before then, surveillance at the airports were heightened. And I remember that even at a time when most developed countries are not taking the temperatures of their arriving passengers, we already saw that in Nigeria. And then as soon as the first pandemic case was, the first index case was reported in Nigeria, federal government set up a presidential task force on COVID-19 to address the issues. And of course, we listen to the advice of WHO. We listen to advice of our Ministry of Health and the Center for Disease Control at every measure we are taking. At the appropriate time, we heightened surveillance on people coming from 15 countries. And insisted that those people, those passengers must do not just a secondary screening, but must also go on supervised self-isolation.
Okay, Alaji, I've got to go off on a break now. I'm sorry, Alaji, can you hear me? I've got to take a break now. We'll be right back, and then we'll continue with you. Stay tuned, please. Okay, welcome back, and we're having something of a wrestling battle going, technically speaking, with the Minister of Information, Alhaji Lai Mohammed. But yeah, we'll continue our conversation with him a bit more. But Cyril, Abaku, in senior researcher at TVC, is with us in studio here. The other question, in fact, because of the way the thing is going, the one question I'm going to want to ask the man when we get him back is, well, we couldn't get the kind of answer that we wanted to the straightforward question of, can we expect money? People are saying we need money. Yeah, well, there you go. He was explaining that, well, there are other things in kind that are being done that are probably just as valuable as money. That's the sense I got from what he was saying. Now, the other question that I said I'd like to bring to his mind, since we're not getting joy with that particular question, is, are we testing the right people? Because let's remember, it's a pandemic. And I started at the top by saying that the governor of Lagos State, thank God, has actually said he took a test and he's happy to announce that he, his aides, his family, they're clean. In society, are we really testing the right people? Because we're testing, I imagine, big men and those who are, who have been flying and who have contact with those who have been flying. But these people also have aides, they have domestics who, are not as high flying as they are, but can go back to their villages. So that's one thing I'd like to ask him, that are we really testing the right people? Do you think we're addressing that significantly? Okay, in fact, I can put it directly to him. Alhaji Lai Mohammed, I hear that we have you back. Thank you for your patience.
You are talking about whether we are testing the right type of people.
Oh dear, you were overhearing, which is just as well. Go ahead, please, on that. Go ahead.
So, we, like I said at the beginning, this is an imported disease. It's not a disease that's indigenous to Nigeria. Therefore, there are only three ways you can contact the disease. Either you live in a country that has a very high incidence of the disease, or you contact it from somebody who has disease, or it is spread through the community. And that is why our testing has been based on certain protocol and criteria. In the first instance, if you have not lived or traveled to a country with a high incidence of COVID-19 and you have no symptom whatsoever, you have no business being tested. If you have come into contact with somebody who has tested positive, but you have no symptom, our advice is for you to go and self-isolate. And when you start having symptoms, you contact us. However, if you already have symptoms, whether you have traveled with anybody, you have traveled to the country with COVID-19, or you have come to contact or not, but you have the symptoms, would take you into self-isolation and treat you. Now, we are doing this because we have limited resources at our disposal, and we do not want to use or waste these resources by testing those who have no business being tested. And what we are doing now, in addition, is that we have increased the number of our laboratories from 5 to 7, and before the end of this week, we'll have 10 laboratories that will be working. From 500, but testing about 500 people a day, today test about 8,500 people. We're also looking into ramping up our other technologies like the GenSpat machines, which, if when they come on stream and we get the right cartridges, will be testing hundreds of thousands of people every day. And in next 2 weeks also, 2 private laboratories will come up that will add a 5,000 per day testing capacity to what we are to our laboratories. However, like I said before, since there is no cure known for this disease, we must continue to listen to our experts, our advice, and our health advisors when they tell us that the best way is to keep social distancing, wash our hands, because prevention is better than cure. When we ask you to stay at home,
yes,
it's because we do not want this disease to spread. Unfortunately for us in Nigeria, we're almost getting to the level of community spread, and that will be more dangerous for us to handle. So people should please listen to government directives.
I think there's also a question of Alaji Lai.
To the hospital.
There's also the question of how well equipped we are. What are these equipment that we're hearing about, respirators or ventilators? Well, even it was agog on Twitter yesterday that Nigeria was actually begging Elon Musk, you might have heard about it, and that the propriety or otherwise of that, even though the said tweet was taken down. But maybe the overall question is that in terms of equipment that we need, testing and ventilators, how well are we doing?
You see, we are putting our emphasis on the wrong issues. Ventilators are not the issue right now. You don't need ventilators until your case is critical. Let's continue with the non-pharmaceutical intervention, which is please keep social distancing, Don't congregate. Don't go to parties. Don't go and play football when they say you should stay at home. Maintain distances between people who have between one another. And then you will not need ventilators because we don't get sick.
Okay.
Only ventilators. I have to explain to you.
Yes.
Even if we test positive today, what we do is that we put in an isolation center. As long as it is mild or moderate, we don't even need to go to a hospital. We put you in an isolation center, and we are now in the process of accrediting all our isolation centers, because not every space can be used to be an isolation center. There are basic requirements that you need to meet. And also, we are ramping up training of personnel, because not everybody can handle, infectious disease. So please, we do not want people to start crying for ventilators now. Ventilators, a lot of by United Nations, as well by WHO modeling, only about 5% of those, I think between 2 and 5% of those who are testing, who are in the hospital, will ever get to the level of ventilators.
Okay.
So please, while we are preparing for the worst, we would still please enjoin Nigerians to obey this simple stay at home, do not go to parties, wash your hands with soap regularly, use face masks if as much as possible, and please use sanitizers. Those are the very basic things that will not make you even test positive. Talk less of coming to an isolation center.
And I think we should thank you very much, Alhaji Lai Mohammed, Honorable Minister of Information and Culture. Thank you, Alhaji Lai, for talking with us.
Thank you.
Okay, so there you are. We got, well, it was sort of a mixed bag. We got valuable advice. We also got some, sort of clarification on some issues about the ventilator thing. Indeed, it's when you really need help to breathe, and he's hoping that, look, if you do all that, if we do all that we can, perhaps we might not get to that stage. But there is the problem of we're preparing. We're preparing for the worst case scenario. All those isolation centers, they don't just have a few beds. They have more beds than actually there are cases right now, because we hope we don't fill them up, but should we need to, yeah, there's going to be that. So here we are. We now switch over to the phones and see if we can get a. Oh, good morning, Mr. George. Thank you very much for calling in. Good morning. We're going through with the phone. That's it, Cyril. That's Cyril. Mr. George, could I just stop you? We got a challenge with the phone lines in here. Well, you are hearing us. Okay. But we can't hear you. We can't. Let's try it for a bit, because I imagine as you'll be speaking, the engineers will be jigging things. So just continue, please, for a while. If it gets unbearable, we'll let you know.
All right. So, as I was saying, the Minister of Information said that the TV program continues even while the children are at home. And I was asking, how is that going to be possible? The children are at home. Are they supposed to carry the food to them at home? Or they are supposed to be money to their parents to buy food to give them? That's one. The other aspect I wanted.
Mr. George, our apologies. Even though you can hear us, it's inaudibly bad. We couldn't make out what you were saying. But indeed, as if it were a game, he said something about minister commenting on ventilators.
And on the school feeding program.
And
he wanted to be sure as to whether the food will be taken to the children in their houses or to be given to their parents to take to them.
Now, you worked that out, because we couldn't hear it, as clearly. And this was my fear. I hope this wouldn't happen. But we have that situation on our hands.
But I think, it speaks to our challenge with social order. Again, going back to the challenge of values, going back to the question of orientation, everywhere we have seen people go to hand out freebies, it's not been an easy task. It has been difficult working within a code. As a matter of fact, virtually, you saw when the minister was in Kwale 2 days ago. She said the ministry had a social register.
One moment, please. I'm sorry to interrupt you. Let me try Adefemi, Mr. Adefemi in Alagbado. Good morning.
Hello, good morning.
Good morning. Please continue.
I'd like to thank you about the program.
Go ahead. It's not much better, but let's see if it will get better. Go ahead, please. Mr. Adefemi, continue. I think they gave up already.
And so you see the throng, people lining up, people, scampering to get the best because they don't want to hear that it got from 1 to 10 and then from 11 there was a story about come another day. So there is this press and there's the pressure. I think that,
is Adefemi, I think Adefemi is still on. Now the funny thing is that is Adefemi being heard at home?
Now, listen. So the name is Akifemi, not Adefemi. It's Akifemi.
Akinfemi?
Now, yes. Akifemi, not Adefemi.
Akinfemi, not Adefemi. We'll fix that.
Yes,
Akinfemi.
Yes. Now, it was talking about price distribution. And me, and I'm looking at the web, how can I get to the distribution center for the good movement? After the country has the data thing. This is Alagbado. This is
Is Alagbado Ogun State or Lagos State?
This is
it's a lockdown state.
If you can get supply, then they go output to output. They can supply them to the boss. If you don't accept me now, I have to be the boss. You have to stay at home. I want you to go out of my home now, going to the local government area and local government area to go and get food. To go and get the boss. It's not possible that way.
Thank you very much for calling in, Akinfemi.
Yeah, I think if I managed to hear what he was trying to
because
say,
the line was still poor.
I think it was the basic fear of, if I stay at home, how will what should be mine get to me? First question. And then I think he was also worried about mobility moving from his house to, for instance, the local government area where he'll be able to register.
Because there's a lockdown.
So,
when
we went on break, I was asking you this question, that when we come back, perhaps we'll ask the minister, but I think, so I also have that question on my mind. I'm wondering, the situation is that if a market woman is allowed to go to market, or shop owners are allowed to open, people selling foods and medicines from 10 a.m. to is it 2 p.m. or from 10 a.m. to 4 p.m., it means that logically they will leave the houses at least an hour or two to be able to get down and to set up. So are we also giving laissez-faire to commercial transport operators? It's important that when a policy pronouncement is made, there are a number of boxes that you must tick. All basic essential questions.
That the people can actually comply.
All corollaries must
comply with
when
these
you leave the public
directives.
guessing, what you find is the sort of brutality we are now seeing. Some Nigerian policemen are copying their Indian counterparts, using all kinds of canes and sticks and so on, and abusing innocent citizens. Why?
That is happening because I remember I was hearing the Lagos State governor say, even though that's not pan-Nigeria, it goes beyond Lagos State, that he had spoken to the police chief in Lagos that people should be humane, gentle, kind. That this is not a criminal situation. It's a health situation. But you're saying that some people might indeed be taking the law into their own hands already.
Wherever you have a gray area,
yeah,
you will have that challenge. So, the other day, the police commissioner too was saying that, look, even as a journalist, you need police pass. But I remember that a day before, the Minister of Information had said, for journalists, your ID card is enough for you.
And then you hear...
So these are some of the... Yes, and so, the information communication at a time like this, it must be orderly. There must be a plan. Development communication plan, yeah? Spelling out what exactly, who does what, and what is expected of who. When we leave gray areas and we fail to tick these boxes, like I said, it becomes a zero-sum game. Everybody seeks to interpret it in his own way. We need to avoid that. What are we doing Uncle Yori.
It's such a pity that, and we're so sorry about the technical situation, you know. But let's give it another shot. Maybe third time lucky. Good morning, Reverend Dominic.
Good morning, Mr. Johnny.
Okay, go ahead. Yeah, we'll manage a bit. It's still poor. It's still poor. Can you hear us? You can hear us. Barely. Go ahead, please, quickly. It seems to get progressively worse.
I want to appreciate the state government, the governor of Lagos State. The governor has done extremely well. You know, I have been with this state for some time. I have been governor and I have been governor. But the governor did extremely well. Prepared for this job. But I want to say,
it seems to get progressively worse. The longer the call lasts, the worse it gets. But go on, say something in the next maybe 15 seconds, please. But I think I heard you say that you're happy with the efforts in Lagos and the leadership going on in Lagos. He's gone.
Yes, because Lagos State taking leadership in dealing with this issue as the epicenter is not because the first case or more cases are here. It could have happened there, anybody could have bungled it. But I think that the leader, so it's not just about the handling of the cases. There is also a leadership example being set. I have personally had friends and colleagues who said they didn't really understand what the governor could do, but that the management of this whole crisis, you see the daily briefings.
Yes. And the man has taken personal charge.
So
he is governor, but he is taking, I think, I forget now, he has a title in there where he is the captain, as it were.
The incident commander in the state.
The incident commander. He has so many experts all around him, but he's taking this responsibility of leading from the front.
Exactly.
And then the latest move, actually testing himself so that he would not be distracted by any of this. Well, we've run out of time. Again, once more, apologies. It's not what you're used to. You know, we're used to talking with each other, but we're working on that. And this is our last day, that is, of the week, because we don't do weekends. But by Monday, we'll be working right round the clock to see if we can sort all these matters out. It really, there's nothing like being able to talk to each other. And we shall hopefully be able to do this. But thank you for those that tried. Thank you for the minister for coming on Skype, and indeed for Dominic and Mr. George and Mr. Akinfemi that tried, but it just wasn't working. Thank you very much for joining us. Do be safe over the weekend. God willing, we'll see you on Monday.